So this year we have again changed the standard of care of our patients with ovarian cancer. Three major phase 3 trials trying to answer the question of PARP inhibitors in first line were presented. That was the PRIMA trial, that was the PAOLA-1 trial, and the AURELIA trial. All three trials were presented at Presidential Symposium, and two of them are already published at the same time in the New England Journal of Medicine. All three trials reached their primary endpoint, and that means that we can have possibility to give PARP inhibitors to our patients. Although there are some differences between these three trials, the PRIMA trial, which was late breaking abstract 1, it was a pure maintenance trial. After surgery and chemotherapy, patients were given either niraparib or placebo, and it showed substantial benefit in the BRCA-mutant population, also in the HR deficient population, which were BRCA wild type, and there was a clinically significant benefit in the HR proficient population. That means that whole population of the trial is benefiting. Then we saw late breaking abstract 2, which was PAOLA-1 trial. Their standard of care was chemotherapy plus bevacizumab given both as concurrent and maintenance therapy. At the time of maintenance therapy, patients were further randomized to receive either olaparib or placebo. So it was combination of olaparib plus bevacizumab or placebo plus bevacizumab. Again, it showed significant benefit in BRCA mutant population and significant benefit in HR deficient BRCA wild type. However, it could not show any benefit in the HR proficient disease. The third trial was a different trial where veliparib in the AURELIA trial was given both as combination with chemotherapy and maintenance. And we have answered a couple of very important questions. First of all, we found out that combination of veliparib with chemotherapy is not effective. It is not improving progression-free survival. Otherwise, AURELIA trial was positive for its primary endpoints. Basically, in the BRCA mutant population, you see the highest, the great benefit.